Laxmi Agarwal is an acid attack survivor whose story not only highlights the brutality of gender based violence, but also demonstrates the power of trauma recovery and intervention.
In this presentation, we will explore a fascinating event, Lakshmi's perception, emotional and psychological responses, and proposed interventions using evidence-based crisis models.
We also analyze the case using psychological first aid, Lerner and Shelton's 10-step protocol, and Kaplan's equilibrium model to find strategies that offer a comprehensive mental health approach.
The crisis began on April 22, 2005, in Khan Market, New Delhi. Laxmi Agarwal, a 15-year-old schoolgirl, was walking alone in a public space when she was attacked with acid. The perpetrator, Naeem Khan, who was also known as Gudu, had been harassing her for months for rejecting his advances. He stated the attack with his brother's girlfriend who threw the acid on Lakshmi's face. This deliberate act in broad daylight caused severe chemical burns to her face, neck, and arm. The attack left her physically disfigured and marked the beginning of a long-term emotional and psychological crisis.
It wasn't just a personal attack, it was a systemic failure. Acid was legal and accessible, and no one intervened during the attack. It triggered national outrage and initiated broader conversations about acid violence, women's safety, and legal reform.
From Lakshmi's perspective, the acid attack was a shattering violation. She perceived it not only as a physical violence, but as an attack on her autonomy, dignity, and identity. The trauma was deeply personal, stemming from her assertion of independence against a man who couldn't accept rejection.
She likely felt helpless, shocked, and betrayed by the attacker, by society's passive spectators, and by the system that allowed this violence to happen. The trauma fractured her sense of safety and societal values, particularly in a context where appearance heavily influences perception and the acceptance of women.
Immediately after the attack, Lakshmi experienced acute reactions of stress, like shock, pain, panic, emotional disorientation, as well as losing consciousness. As the disfigurement settled in, so did emotions like grief, loss, humiliation, and a sense of fear.
Psychologically, she was at a high risk for PTSD, depression, body image, and social isolation. The stigma around her altered appearance may have amplified shame and withdrawal. However, over time, Lakshmi shifted from victimhood to advocacy, showing signs of post-traumatic growth. She turned a personal tragedy into a campaign for justice and reform. Though psychologically, the challenges likely persisted.
The first step in responding to such a crisis, immediate physical intervention. Removing the patient from physical danger, irrigating the wounded areas with water, and seeking emergency medical care. These steps are life-saving and foundational before any psychological care can begin.
As mental health professionals, we apply psychological first aid by World Health Organization. This includes ensuring emotional and physical safety, offering grounding techniques, assessing needs, connecting the individual with trusted support systems, and offering psychoeducation. For Lakshmi, this would mean gentle reassurance, trauma-informed listening, and connection with legal and survivor networks.
To understand how trained professionals would have handled Lakshmi Agarwal's crisis using a more structured approach, we turn to the Lerner and Shelton's 10-step acute stress and trauma management protocol. This model is particularly relevant for immediate crisis intervention following violent or traumatic events.
First and most urgent step to do after the attack was to ensure the scene safe. Emergency responders and bystanders gave information that there was no ongoing threat to Lakshmi or others.
In Lakshmi's case, the use of acid as a weapon was both deliberate and premeditated. This wasn't an accident, but an act of targeted violence.
The responder would assess whether Lakshmi was conscious, coherent, or in shock. Given the physical trauma and emotional intensity, she may have been disoriented or dissociated. This step is about determining whether she can engage in conversation, follow instruction, or need immediate calming support.
And the fourth step is to address medical needs. Lakshmi sustained severe chemical burns, and this also involves immediate medical triage, irrigating the burn, managing pain, protecting her airways, and transporting her to an emergency burn unit. No psychological intervention can be effective without addressing the physical stability first.
Stabilized, professionals would begin observing signs of acute stress, such as crying, silence, dissociation, or tremors. Lakshmi's nonverbal cues, eye contact, and physical reactions would guide how to proceed with emotional support.
Establishing a human connection is key. This means using simple language, showing empathy, and approaching Lakshmi gently. Even saying, I'm here with you, or you're safe now, builds rapport. Trust building is vital, especially in the case of intimate targeted violence like this.
Grounding helps reduce dissociation and restore awareness. The respondent may encourage Lakshmi to name where she is, who she's with, and what she feels. Using phrases like, you're in the hospital, or I'm holding your hand, can gently bring her back to the present and reduce fear.
Eighth step is to provide support. Now, support here means being present, listening actively, and validating emotions. Saying it's okay to feel scared or you do not deserve this would help Lakshmi feel seen and heard. Particularly, the involvement of a trusted female caregiver or advocate could strengthen this step.
Lakshmi's reactions, fear, confusion, rage, or numbness, would be normal responses to trauma. Explaining that what she's experiencing is common and that she's not going crazy helps reduce self-blame and anxiety. This also lays the foundation for longer-term recovery.
Finally, the professional provides information of what comes next, possible psychological symptoms, medical treatment, and available resources. Connecting her with mental health services, legal aid, and burn recovery support is part of empowering her toward long-term healing.
Kaplan's equilibrium model helps us to understand how the attack disrupted Lakshmi's psychological balance. At the time, she was a vulnerable adolescent whose typical coping resources like family, education, social identity were overwhelmed. After the attack, she likely experienced the loss of internal coping and external support systems, increasing the risk for long-term trauma. The role of a mental health professional is to restore balance by reducing the stress and helping her regain a sense of control.
This includes crisis counseling, psychoeducation, legal and medical advocacy, and encouraging re-engagement with positive identity roles like her later work as an activist. Empowering her through small decisions, validating her experiences, and reconnecting her with meaningful roles is key.
Ultimately, the model shows that if equilibrium is restored with the right support, the client like Lakshmi can grow beyond her trauma. If not, the crisis could cause chronic psychological disorders. Intervention that was not about solving everything, but about reclaiming agency and hope.
Lakshmi Agarwal's story is not just one of pain, but of profound transformation. Her experience represents a powerful case for understanding crisis through a trauma-informed lens. Lakshmi Agarwal became a leading voice against acid violence after surviving a brutal attack at age 15. She filed a public interest litigation in 2006 demanding stricter regulations on acid sales and better support for survivors. Her relentless advocacy led the Supreme Court of India in 2013 to impose regulations on the sale of acid, including requiring buyers to provide identification and limiting availability. Her efforts significantly contributed to both legal reform and public awareness surrounding gender-based violence in India.